Happy Friday, Baylor College of Medicine and friends of Baylor. Today I want to talk about two major things. First of all, what is going on with India, and can we learn anything? And the second thing is, what's going on in the United States? And once again, we seem to be changing our minds as to what we want. I mean, I thought we were going for herd immunity, and now we're not going for. I don't get it anyway. Let me try and put some rational thinking into this if I possibly can. First thing is India. Oh my Lord, that's India. What a disaster for them. You know, it's funny because they were doing so great, but India is now second in total cases in the country, in the world, and third in deaths. They are no question underreporting, so maybe taking over the number one soon in both categories. But, you know, it's funny because from June to November, they had a little bit of a peak. And they locked down the country really, really well and seemed to go down to very low numbers of cases. So that first wave, they had a very high jump in seropositivity from 18 to almost 40%. So a lot of people were getting infected. But cases only peaked at about 100,000 a day. Remember, we were having 250, 300,000 a day. And deaths, this was very interesting. Deaths were only 41 per 100,000 compared to the U.S., were more like 500 per 100,000. And so it was very confusing. They had a lot of cases, but the death rate was very low. And then it sort of just disappeared. It was almost flat for a long time. And unfortunately, the public health measures sort of fell apart, frankly. They decided to start having large gatherings, many people without masks. They stopped mandating the people wear masks, and they opened schools. And the second wave began really in March, and the number of cases has increased to almost 400,000 a day. And the hospitals are being overwhelmed. Now, the fact of the matter is, even though there's so many cases and hospitals are being overwhelmed, there's a paradox because the case fatality rate is still very low compared to the U.S. So why is that? Well, the first thing is it really true? And there's a large petition by many, many Indian scientists and physicians going to the government saying, we think you're underreporting deaths and cases. And so we sort of have to believe the data they're reporting, but even the Indian physicians and scientists aren't so sure that it's accurate. But there are real reasons why it might be true. For one thing, India is a lot younger population. If you look at the census of India most recently, 45% of the population is under the age of 19, whereas in the U.S. it's about 24%. And there are only 4% over the age of 65 compared to 13% in the U.S. So you have this dramatically younger population. So you could understand why, even though many infections, there might be a lower mortality rate. Of course, there's so many people there, that's why the hospitals get overwhelmed. There's also a major wealth gap in India. So people in their 70s and 80s are usually pretty well of means, and they are much better able to isolate themselves and obtain health care. And so that might be another reason why there's this disparity in the number of cases and the number of people and the case fatality rate. And the other thing is there seems to be a very high rate of asymptomatic infections. And so, you know, it may be that there's also lower morbidity in India. So we just don't know. But why this huge surge that we're seeing on the national is playing out everywhere in the world? Well, they had, as I mentioned, a very effective lockdown initially. But remember what a lockdown does. A lockdown prevents anyone from getting out. And so the end point of a lockdown is, like in China, if you can get rid of viral transmission for a month or 6 weeks, and it disappears, then you can reopen, there's no virus. The other point of a lockdown is you try to get it to something else, like a vaccine. So if you lock down the community so no one's getting infected and you vaccinate people, then you're okay. But if you lock down and nothing else has changed and you open it up again, then everybody's basically susceptible, and that's kind of what happened. So things were looking really good in India. We kept talking about, you know, of all the countries in the world with so many people and not in a lot of poverty, still able to do well. Well, not in this last surge. For one thing, they totally lifted all the public health restrictions. The population itself pretty much abandoned physical distancing and mask wearing. And they used to enforce mask wearing in public, and they stopped doing that in February. So the other thing is, despite the fact that they're a major manufacturer for vaccines, they don't have vaccines. They're exporting them all. So only 9% of the population has been vaccinated. And the supply chain's all messed up because they're basically sending vaccines to everywhere in the world, but not to them. There's a huge logistical problem with billions of people in trying to distribute vaccines. And the other thing they did is they centralized the purchasing of vaccines, but they've decentralized the distribution of vaccines, kind of like the U.S., So but we do a better job at the state level than they do at actually distributing the vaccines that they have. But if you think about it, public health restriction alone, the changes that they made were probably not enough. There were two major super spreader events. The first thing is that there are five major states in India were holding parliamentary and local elections in March. The communities of Assam, West Bengal, Tamil Nadu, Kerala, and Pondicherry. And what happened was they had these massive political rallies, enormous crowds that did not wear masks, and politicians who did not model behavior right and didn't wear masks. Sounds familiar. And because of the huge number of people who are polling at these polling stations, they have the polling stations open for many, many weeks, and they had large numbers of unmasked crowds at all the polling booths. So their political events turned out to be gigantic spreading events. Sounds a little bit like what happened in the Midwest in the United States. The second major problem was a religious ceremony known as Kum Mela. This is a Hindu religious event that has been taking place for 1,000 years or more. And it occurs every 12 years, and it rotates between 4 holy sites. All are near banks of large rivers, because you got to go in and dip in the river to get rid of your sins. The last one was held recently in March, and it lasted 11 to 12 weeks in Haridwar on the banks of the Ganges River. Now, usually, these things attract 30 to 40 million people. But because they were practicing, public health measures, it was only 8 million people all congregated without masks. I mean, it's crazy. So holy men from all over the country, many Hindu sects, they would congregate for prayers and education. Of course, they would dip in the river. Now, over the years, this has been a very peaceful ceremony. They're not violent outbreaks, but almost every time they have one, there's a cholera outbreak. So you can see how bad it is having that many people all clustered together. Well, imagine in the middle of a COVID pandemic, 7 to 8 million people all gathered together, no masks, bathing in the Ganges. Now that is a super spreader event. And then finally, I'd say the response of the government has been at best schizophrenic. I'm going to give them schizophrenia as the diagnosis. So many of the states, and there are 36 different states and territories, many of the states mandated lockdowns, but some of them didn't. And they all have different policies. Can you imagine a country where 36 states and territories all have different policies around public health? Oh yeah, the United States, I forget about that. We did that too. But it's a problem. And then the other thing is they decided we'll vaccinate everybody, except they didn't have vaccines for everybody. So there was no protecting the vulnerable, and they don't have much vaccines. And so there was also huge confusion over who could buy vaccines. So in India's case, the federal government, the union, bought the vaccines, but it wasn't very clear how they would distribute them. And so now they've loosened it up so the states can buy vaccines, but they don't have much to buy. So it's a real problem. The hospitals are overrun. They're even short of oxygen tanks. I mean, it is really a humanitarian crisis. It's really, really too bad. There's been a big discussion about, is it a separate variant that's terrible, that's really playing a major role? Well, the variant is B.1.617. It probably is playing some of a role. It's called a double mutant, even though it's got something like 15 to 17 mutations in it. It's a misnomer because it actually has a little bit of the South African variation, a little bit of the California variant. But if you look, and these are investigators at Temple that did this, if you look at the lineage, where it came from, it actually preceded the development of the UK variant and the South African variant. So it was a common ancestor earlier. It came from the Wuhan outbreak. Yeah, that doesn't make a lot of sense when we think about it, but in fact, with India being such a large number of people who were susceptible, it's a founder effect. If one person gets infected and starts spreading it to a bunch of susceptible people, that will be the dominant virus, even if it's not more fit than some of the other viruses. So it looks like the India virus has been around for a while because it was the predecessor to the UK and to the South African variant. But it may not be more infectious. It actually may not be more infectious than the other viruses. It's just that there's so many people who are susceptible. So India, what can we learn from them? Well, probably public health measures work. They need to get their vaccination program in order. They need to probably go back to a more severe restriction and locking down because they have so many people who are sick. It's really sad. So hopefully they'll get their acts together and things will be better. And of course, we're holding out for Peter Hotez's vaccine, which is in India. BioE is developing it. Hopefully in phase 3 they'll be able to figure out it works, and then there'll be a locally produced vaccine for India. So that's my hope for them. So what's going on with the United States? I don't get it. We were all pushing for a 65-70% vaccine rate, combined with us all having about a 25% prevalence of the disease. We'd reach herd immunity. And as I've said each week, herd immunity doesn't mean no one gets infected. It just means that the rate begins to go down slowly but surely, and people are still susceptible. But at least the R number's less than 1, and we have fewer and fewer cases. If you'll recall, I want to show you this because this graph I showed on March 19th, almost 5-6 weeks ago. This was the projection from the IHME. Remember, they're the health metrics group at University of Washington. And at the time, we were looking at it saying, here we are. What are we going to do? Are we going to go down to nothing, or are we going to go have a little bump and be sustained? And the concern I had at the time was that we have already begun to return to pre-COVID levels of mobility, and we're already loosening up mask orders and public health measures. And my concern was we would end up following that curve of the worst case scenario, which is we just keep having a lot of cases. Well, this is what's going on in the Texas Medical Center. You can see that curve superimposed above it. Look at that. We are almost identical to the worst case scenario. And so what looks like what has happened is because of our increase in mobility, our removing a lot of our public health measures, and the rise of variants, we are in that sort of steady state plateau where we keep sticking with an R number of 1, a caseload of 700 to 1,000 in our region every day, and flat hospitalizations. They just don't seem to be going down. So, our only hope to get out of this just constant 700 to 1,000 cases all the time is really vaccination. So we need our neighbors, people who are reluctant, to go get vaccinated. And and we say, well, what about, does herd immunity really make any difference? Forget the term herd immunity. We need enough people vaccinated where the case rate begins to fall. And does it really make a difference? Well, it really does make a difference. So I took out the CDC map of where we are with vaccination. And here's the map. It's very interesting. And I took, let's look at Vermont and New Hampshire because they're right next to each other. Vermont, of course, the state of Ben and Jerry's. Everybody gets a free bowl of ice cream, according to Bernie Sanders. And New Hampshire, live free or die. In other words, don't take my ice cream or I'll kill you. So the same, right next to each other. Vermont has a higher vaccination rate than New Hampshire. And then I took another state, Georgia, which is even less than them. And if you look at just based on the efficacy of vaccination, what is the impact on hospitalizations and death? So Vermont has 39% fully vaccinated, New Hampshire 30%, intermediate, and Georgia 25%. Well, guess who has the lowest hospitalization rate? Vermont, second lowest. New Hampshire, third lowest. Georgia. And guess who's got the lowest death rate? Vermont, New Hampshire, and Georgia. So here's an example in our own country of just taking states that have a higher vaccination rate. They have fewer hospitalizations that are dropping, and they have less deaths. Well, let's look at countries. Let's look at Israel. Israel is amazing. So they've really done well at getting vaccination. You can see that on February 24th, they actually hit an inflection point. They got up to 50%, and then they've been trying to get higher and higher and higher. But they eventually got to 60% of the entire country with vaccination. United States, in contrast, has been lagging. We're around 40% fully vaccinated. Well, 2 weeks after achieving just 55% of vaccinations, look what happened in Israel to the new confirmed cases. Dropped like a stone. So that's why we need to keep pushing to get to 55 or 60%. We're at 40%. And rather than throw our hands up and say, well, we're giving up on that, we should be saying, we got to get to that number, because that really makes a difference. So that was 2 weeks after achieving 55%, their new case load began to drop. And this is their hospital admissions a month later. So you remember, a lagging indicator, dropped like a stone. So that's what we need to do. We need to keep pushing up. We shouldn't be giving up on that. This is the data for the U.S. If you look at it, we're in this steady state, this plateau that I said before was the worst case scenario. We just keep chugging along. We've got 30% vaccinated as contrasted to 55% in 60% in Israel. We have 44% that are now at one dose, but we need to get fully vaccinated, because the fully vaccination is really important for dealing with the variants of concern. The trouble is, as we keep saying, oh, it's great, we're getting vaccinated, more and more vaccines. This is from the CDC. Look at what's happened. We were doing really well, and our vaccination rate is like dropping off pretty dramatically. That's really not good, because we will not get to where we want to be without everyone at least getting 60% vaccinated. We're up to about 872,000 people in the Texas Medical Center who have been fully vaccinated. But like the rest of the country, we're seeing a drop in vaccines. So we went up, and now it's beginning to tail off. We're seeing fewer and fewer people wanting to get vaccines. So let's not worry about the rest of the world. Let's just talk about Texas and Houston. For us to get back to normal, where we're not wearing masks and we're not having a lot of cases, we have 7 million people in the region. 60% is the number that really made a big difference in Israel. That would be 4.2 million people. We get 4.2 million out of the 7 million vaccinated. I think we'll begin to see what Israel should, because the vaccinations are very effective against the variants. It doesn't make any difference what variants here. So if you look at that now, there was a study that we did on prevalence in February that said that we were about 14% prevalent, and that, in other words, 14% of the population have been infected, but it's probably higher now, pretty significantly. So let's assume 20%. So 1.4 million of the 7 million have already been infected. We have about 900,000 are fully vaccinated. If you add 1.4 million and 900,000, that's 2.3 million. So we need 1.9 million people more vaccinated. We were up to about 18,000 a day. We're down to 12,000 a day. If it's 12,000 a day, that would take about 160 more days. That's 5.5 months before we begin to get to that 60% number. And so, we don't want to be dealing with this in the end of October. We want these numbers low at the beginning of school year in September. So we've got to do a better job. The good news is that kids probably will be entering the vaccine programs, and there are about 500,000 under the age of 5 and another 700,000 between 6 and 12. So if we can get at least a lot of the kids vaccinated, that could contribute another million. But still, we still need, we have months and months of people getting vaccinated, and we're going to have to figure out the people who are reluctant or don't have access to the vaccine have got to start getting vaccinated. And this is it was a nice a graph published in the New York Times that showed, if we, at the current rate, we could get to 70 or 80% national vaccination rate by by September. The problem is, and I drew this red line, this is what's happening, we're dropping off. And if we continue to drop off in pace, we may not get to 60% even in October or November in the United States. We all want to go to restaurants. We want to fly. We want to go to other countries. We want to do things that normal people do. And we can't do this unless everyone pitches in. So, I've been saying all along, one of the best ways to get a lot of people vaccinated is don't let anybody going to college or leaving college leave without getting vaccinated. That's a good way to get those 18 to 20-year-olds vaccinated. And I think we should be mandating college kids all get vaccinated. Why would I say that? Well, if you look at the CDC outbreaks, the biggest outbreaks in the country have been at universities and colleges. University of Florida at Gainesville leads the way with 10,000 cases. Indiana University, 8,500 cases. The Ohio State, 8,000 cases. University of Wisconsin, 7,000. I went to Michigan, so it's actually the University of Michigan. But anyway, all these schools are like 7,000 to 10,000. I should throw out Arizona State. Arizona State was 7,000. It's just, there's so many outbreaks with these kids being clustered together. What a great opportunity to get them all vaccinated and make a difference. And as I said before, the reason to do it is because the vaccines work against not only the original strain, but the variants. They're very effective. The only one that doesn't really work is AstraZeneca, that doesn't work for the South African and the Brazilian variants. But Pfizer, the Moderna vaccine, J&J, they all work very well for not only the original vaccine, but the original strain, but the variants as well. So, I'm a little frustrated, just going to be honest with you. I don't understand why people are sitting around being reluctant to get vaccinated. We have over 100 million doses of the RNA vaccines, no problem, and we have, and the people who are most interested in opening up the economy and having our personal freedoms, they're the people that are reluctant to get vaccinated, and they're the ones preventing us from opening up the economy and having our personal freedom. So I really wish we could all talk to our friends and neighbors and those who are reluctant and just tell them to get vaccinated. Or if they don't listen to you, call me, give them a personal call. I'll take the next million phone calls to get people vaccinated. Anyway, so interesting lessons to learn from India. And hopefully we'll start talking about getting back to a 60% to 70% vaccination status and not having this confusing stuff come out about whether we're giving up on herd immunity or giving up on this. We need to get to 60 to 70% vaccine rate in the United States. So let's all push together and try and make it happen. We're all in it together, whether we want to be or not. We are all in the same boat. And I want to end with a couple of shout-outs. Dr. Traber Giordina, Assistant Professor of Medicine and Health Services Research at Baylor and iQuest at the DeBakey VA, has been selected as one of the 10 scholars for the National Academy of Medicine Scholars in Diagnostic Excellence Program. This is a very cool area. They actually work on reducing misdiagnosis in healthcare and increasing patient safety. So we're very proud of Dr. Giordina. And then, of course, our own DeBakey High School for Health Professions was ranked in the top 50 schools in the nation by U.S. News & World Report. We have been working with them on the first health sciences high school in the nation since 1972. Very proud of them. Huge shout out to the DeBakey High School. So let's all push together and pull together. Baylor College of Medicine will do everything we can to help. So have a great weekend, and I cannot wait to see you next week.